number, as well as come through to us live or utilize the question and answer section. So that's my little briefing for today. It's my pleasure to welcome Dr. John Kengasong, who is the director of the Africa CDC, for his usual briefing this Thursday morning. Dr. John, it's over to you.
Thank you, Wayne. Good morning from the African Union, headquarters in Addis Ababa, and from the Africa CDC. As always, it's my pleasure to have the opportunity to interact with with all of you on this platform to provide an update on the COVID situation on our continent. And we'll divide it as usual into three parts: the epidemiological situations and trends, where we are with the supporting countries and our strategies, and then we'll conclude on the vaccination situation. As of today, the 3rd of June, 2021, the total of 4.8 million COVID cases have been reported. And this accounts for 2.9% of the global cases. The total number of recoveries stands at 4.4 million. That represents the 90% percentage of the total of people that have been reported. 131,000 deaths have occurred so far, unfortunately, and this results in a case fatality 7%, which has been stable over the last couple of months. In terms of who is contributing more with respect to the caseloads, at least 5 countries are contributing about 60% of the infections, with 34% of those from South Africa, 11% from Morocco, 7% in Tunisia, 6% in Ethiopia, and 5% in Egypt. The case for at least 21 countries on the continent is equivalent to the global total of 2.1%. Let me just say a word on variants. 29 countries have reported the B117 variant, which was originally reported in the UK and has now been renamed by the WHO. And this is the last briefing that will use the word the B117. We'll be reverting to the new nomenclatures. That is the Beta, the Alpha nomenclature for during next week's briefing. But for this week, we'll use the traditional briefings nomenclature. The B1351 variant that was originally identified in South Africa has now been reported in 26 countries in Africa, and 12 countries have reported the B1617 variant, which was originally identified in India. So we can see that the variants continue to circulate, and some countries have a mixture of all three variants. Let us now look at the trends for 1 week, and then we'll look at the trends over 4 weeks. So between 24th and 31st of May, we have observed the following trends. In terms of new cases, the continent has reported 74,000 new cases of COVID infection, and this represents a 7% increase from the previous week. The highest proportion of these new cases are coming from Southern Africa, 48%, with other regions contributing as follows: Northern Africa, 31%, Eastern Africa, 14%, West Africa, 3%, and Central Africa, 3%. The following 5 countries are reporting the highest number of new cases. South Africa with 27,000 new cases reported over the last week. Tunisia, 9,000. Egypt, 7,000. Uganda, 3,000. And Kenya, 2,000. So you can see from these statistics that on why South Africa has decided to adjust its measures, the restriction measures that President Ramaphosa announced just early this week. because of it's very likely that the country is going through, will be going through a third wave. In terms of new deaths, we recorded 1,900 new deaths across the continent compared to 2,200 deaths last week. And this represents a 14% decrease over the previous week. If we now look at the last 4 weeks, we've observed in terms of new cases, 3% average increase across the continent. And in terms of the deaths, about 3% average decrease across the continent. 48 million tests have been conducted cumulatively since the pandemic started on the continent, with a total of about 950,000 conducted just last week. And that represents a 2% increase from the previous week. The overall case fatality positivity rate, I beg your pardon, positivity rate is still high, about 10%, with a test per case ratio of 9.9. We, as Africa CDC, continue to work with member states to manage the distribution of 700 oxygen concentrators and accessories to 26 member states, just to beef up their capacity to be better equipped to manage COVID patients. Let me just now segue to our vaccination situation on the continent. As of June 1st, a total of 53.5 million COVID vaccine doses have been procured by 50 member states across the continent. Total vaccine doses administered is 38 million, with about 60% of the total supplies used already or administered. The coverage is 0.54% of the population have received full vaccination on the continent, just 0.5%. And this represents a slight increase of 0.8 compared to the previous week. The following 5 countries are administering the most vaccines so far: Morocco, 14 million, Egypt, 2.4 million, Nigeria, 2 million, Ethiopia, 1.8 million, Zimbabwe, 1 million. A couple of countries have not yet started their vaccination rollout on the continent. That include Tanzania, Sahrawi Republic, Eritrea, Chad, and Burundi. On the 27th of May, Rwanda received another delivery of 247,000 doses of AstraZeneca vaccines from the COVAX facilities, including 117,000 doses donated by France. These will enable the country to resume its vaccination campaign and fully immunize those who previously received the first dose of the vaccine. Rwanda additionally received 100,000 doses of the Pfizer vaccine from the COVAX facility on June 1st. On the 30th of May, Burkina Faso received 115,000 doses of the AstraZeneca vaccine from the COVAX facilities, and the country launched its national COVID-19 vaccination campaign on June the 2nd. Very encouraging to see that they received their vaccines on May, the last day of May, and on the very first, a few days later, started their campaign. On the 1st of June, WHO included Sinovac vaccine on its emergency use listing. Sinovac vaccine, is an inactivated whole virus vaccine that can be stored at normal fridge temperature and easily roll out in resource-limited settings. On the 2nd of June, 2021, Mauritius transitioned to the Sputnik Light vaccine from Russia. The Sputnik Light is the first component of the Sputnik V vaccine, and it will be the second single-dose vaccine approved for use on the continent after the Johnson & Johnson vaccine in South Africa. And that is very good news. Let me just conclude by giving you a very brief update on my visit in South Africa. The purpose of the visit in South Africa was actually twofold. One was to look at their vaccination program and learn lessons from there, just like we did for Rwanda. But secondly, was to join President Macron in the visit on his invitation to discuss continental manufacturing of vaccines. And which that discussion, as you all know, those who followed the press conference between President Ramaphosa and President Macron, the President of France, they all agreed for the need to increase local manufacturing on the continent of vaccines on the continent. I had the privilege to visit 2 vaccine sites in South Africa, one in Port Elizabeth, that is the Aspen site, which is currently doing the fill and finish of the Johnson & Johnson. It was quite, I would say, emotional to stand there and see the vials, the little vials of those vaccines come out of their filling line, and to grab one in my hand and look at it and say, this vial can save 5 lives, because that little vial contained 5 doses of vaccines. It was actually quite an emotional moment, and I can't wait to see those vaccines be shipped out from South Africa across the continent as part of our Avat vaccine acquisition. Avat, of course, is the African Vaccine Acquisition Task Team. I also then went to Cape Town at the Biovac facility to visit the huge industrial complex they have for vaccine production. And I'm really amazed to see that they are like shovel ready to be able to produce several types of vaccines. They're currently producing vaccines, but they can actually easily move into full speed in terms of producing the RNA vaccine. So it was a very good meeting. We look forward to the remarks from President Macron were very encouraging, very supportive to building partnerships for vaccine manufacturing in Africa, but also more specifically to calling for a tighter working relationship between COVAX and Africa's CDC and Avat, so that we can push the continent collectively to get to at least 60% of our vaccination target. So thank you, Wayne. I think I'll turn it over to you so that we can move into the question and answer session.
Thank you very much, John. And it is really very encouraging to hear that very soon vaccines made on the African continent will be used to save African lives. Thank you very much for that briefing. So we go immediately into our questions. And colleagues, today we are starting with our sister, Sophie Mukwena. And Sophie is the news editor at the South African Broadcasting Corporation. Sophie, good morning, and please go ahead with your question.
Thank you so much, Dr. Kenkesong. I just want to find out, you just concluded your remarks about your visit to South Africa and your visit to Gqeberha, the manufacturing plant of vaccines and drugs in South Africa. And you spoke about your excitement when you saw the vaccine. But there's now a new challenge. The U.S. Food and Drug Administration has postponed the announcement that was expected on Friday, where they were going to perhaps indicate whether the Johnson & Johnson vaccine can be rolled out because of the challenge they had in the United States of America. South Africa took a decision to stop the rollout because of that decision in the United States of America. What impact will this have in the rollout of vaccines on the continent, and in particular South Africa, because already we have ruled out using AstraZeneca, and we were hopeful that Johnson & Johnson vaccine will be rolled out soon to complement Pfizer. With Pfizer, with all the challenges and South African electricity supply, is this not a crisis?
So, Sophie, thank you for that question. And just before I came on this briefing, I was in contact with our colleagues from Johnson & Johnson. Because yesterday is when the commissioner at the FDA, the Food and Drug Administration at the US, were going to inspect that site and make an announcement. I've now been told that they are moving that to Friday. And just news that the exchanges that I got from Johnson & Johnson, now we're all watching that very carefully. And we want to know And I will actually just ask for a patient that let's wait until Friday or early next week, and then we will have a comprehensive picture of what is going on. I will be making my own direct contacts with the FDA and the US CDC to understand the trends of thinking, at least before Friday. They may or they may not disclose anything, but it doesn't hurt to reach out and ask. I think South Africa is not the only country affected. It's a country that is looking forward to using a lot of Johnson & Johnson. As you recall, our entire Avat strategy is underpinned by the need to have 220 million doses from Johnson & Johnson with an option of taking it to 400 million. So again, I just want to, we are living in a time of uncertainty with many things, and we just remain calm and see what will happen, and then we can pick it from there. But I remain always hopeful that the findings will always weigh on the side of safety and the side of effectiveness of the vaccine. We're dealing with human lives here. We want to be sure that we exercise maximum care and caution for the interest of our patients. So we don't want to rush into this. We want to be sure that science drives and guides us, but we just need a little bit of patience to understand. But I'm very sure that by mid next week or early next week, we'll have full clarity on this matter.
Thank you very much, John, and thank you, Sophie. We move on now to Maggie Fick, and Maggie is with Reuters, and she says, thank you for your time. Here's my question. European Union sources have told Reuters that the first step towards implementing their plan to support vaccine and medicine manufacturing in Africa requires the African Union to determine where the regional production hubs will be located. And here comes the question. Do you have a timeline for this setup, and who are the leading candidates?
So, very good question. Just yesterday, I was in touch with the focal person at the European Union to discuss just that. And we have set up a call, I believe it's on next week, to get into the details of what that whole announcement is, the whole entire package. And then, of course, we'll be looking at the specific countries where we can start. If you recall, on April 12 and 13, we had a very comprehensive meeting on a vaccine summit chaired by President Cdcweekly, and President Ramaphosa was there, President Kagame, and we are finalizing a report and a strategic plan that would actually look at which countries are frontline countries, and frontline meaning the countries that already have something and can move quickly, and which countries have the political capital to drive that process forward. Like Rwanda, I mean, you've heard President Kagame openly make a strong commitment and push for messenger RNA. So it would not be a decision of one person. We are establishing a task force that will look into that in a very objective manner and see how the whole of Africa approach can actually be employed. Let me just say this. I was very encouraged in South Africa during the visit by two things. One is the political pronouncement of President Ramaphosa, who said severally that we want to give any country a chance in Africa to produce the vaccines. And it was very clear that he doesn't want the Europeans to tell us which country to do the vaccine production. Leave it with us. We'll discuss, and then we'll come to you with a plan. I really like what I heard in terms of it's not a competition inside Africa, but rather a collective approach. The second thing that was extremely good news in my ears was the leadership of Aspen and Bauvac were all in this mode of let's work together, and not just in South Africa, but also across the continent, so that they can synergize and create efficiencies there. So I think the background thinking has already established the fact that we need to have a collective approach to the development of vaccines. I think our strategy will look at scenarios. what is the entire vaccine manufacturing value chain addition, and so that countries can actually look at the whole value chain and say, look, this is where I can bring maximum input there. The analogy that I always use in this business is that we should look at both two things. One is the manufacturing component and then the demand side of it, and work on the two sides at the same time, because if we do not create a market for the vaccines, then it makes it difficult to sustain manufacturing there. I think that is very important. Then in the manufacturing side, I've always argued that we should actually look at the Boeing approach, sorry, the Airbus approach. The Airbus is the plane that is manufactured in Toulouse, but the parts come from all over the world or all over Europe. So it could really be that the Africa takes a whole of Africa approach, where some countries do certain things and others do certain things. At the Aspen manufacturing side, I was privileged to take up the whole pack of those little glasses that vaccines are put into and look at it. And I asked the question, where is this from? And the young man, very brilliant young man who was guiding us through said, it is made in China. So we should also envisage that a country in Africa could only specialize in producing those little tiny bottles, so that we have it on the continent, produced on the continent, and then supplied to those other countries that can actually produce a vaccine. So the dialogue is on, the scenarios will be produced, and then we'll be sure to share that with you.
Thank you very much, John. We move on now to Paul Adepoju, and Paul is with the journal Nature. And Paul says, what impacts will the expanding vaccine options have on the pandemic in Africa? And how are these newly approved vaccines getting integrated into the Avat and Africa CDC plans?
So we can only be optimistic and hopeful that the new vaccines that are approved will actually also help us increase the uptake of vaccines on the continent. The good news is that the Chinese vaccines that have just been provided with the emergency use authorization by the WHO will also be engaging with COVAX so that they can make available their vaccines through the COVAX facility. I think that will improve our ability and diversify our options to access vaccines, which up to now, as you know, we were extremely constrained with the crisis that India is going through or went through. So with these new vaccines arriving, I think our options and risks will be diminished. So we hope that that will happen quickly. And I think with the new vaccines, the vaccines, once they are approved in terms of safety and efficacy, are all good vaccines, and they are safe, they're efficacious, and it's a question of each country fitting that into their vaccination plans. I mean, so what do I mean by this? If I was in a country X and I had the privilege to have the Pfizer vaccine, because that vaccine requires a minus 70 degrees Celsius storage conditions, I would use that vaccine in major cities, right? Because it would be easy to administer, put them in deep freezers there, and then roll them out there. Then I will use those other vaccines that require 2 degrees to 8 degrees in more distant areas, that is outside of major cities or in remote areas. That's how, I mean, I will encourage countries to think through their vaccines. Don't exclude any vaccine, but make it part of your entire vaccination strategy and implementation plan.
Thank you. We move next to Eswatini, where Bonisile Makubu, who is with the Times of Eswatini, has this to say. So she says, has the COVAX facility secured vaccines for Africa outside of those coming from AstraZeneca? And she says, I'm asking this because Eswatini, for instance, has still not received its share of 108,000 doses, which makes the 20% from COVAX.
So unfortunately, I cannot speak with specifics on what COVAX will deliver to each member state. I'm not privileged to that information, but I can tell you that COVAX has acquire more vaccines, sign more contracts. They've also signed contracts with Johnson & Johnson. They have signed contracts with Moderna, and we hope that and then the Sinopharm and Sinovac vaccines that the Chinese have presented to the WHO and were recently qualified will also be part of that, the whole arena of vaccines. So, but I don't know exactly what the timelines for delivery, say, to Eswatini will be, and neither do I know about what the doses will be. Those are things that we'll continue to, as we engage with the leadership of COVAX, we'll continue to share information, share our information, and then also learn from them. And just to end, I've been on the road for the past 2 weeks, so it's a little bit difficult for me to, we've not been able to connect at the level of COVAX to understand what the current situation is.
Thank you very much, John. And colleagues, let me just give you our WhatsApp number again. It is +251 94 550 2310. +251 94 550 2310. We move on now to Judith Akolo, who is with Kenya Broadcasting Corporation. And Judith says, what is Africa CDC doing to encourage member states through the African Union to begin to support medics through scholarships to be able to specialize so that they can form the critical mass of human resources that is needed to help the continent to confront the health challenges presented by emerging diseases? And then she says, this is also to do with the quest to begin vaccine production on the continent. Where is the personnel, she asks?
Very good question, indeed. If you have heard me on several occasions, and if you were at the meeting where we hosted the vaccine summit, you probably have heard President Tshisekedi talk about a new public health order for the continent. And you've also heard Chairperson Musa Faki Mohammed, the chair of the African Union, articulate that as such, and President Ramaphosa. What does that mean? We are saying there are 4 key areas that we need to prioritize in order to better position our continent to be capable and to fight diseases in future. That first is the workforce, that we need to look at workforce very strategically and say, look, we need 6,000 epidemiologists on the continent. Just to start with that number, we currently only have about 1,900. We need about 25,000 frontline workers. We only have about 5,000. That we need to also follow through with the declaration the head of state called on in 2017 for us to mobilize at least 2 million community healthcare workers. That program has not started there. So that is workforce. Then, in addition to that, we have to look at some research hubs on the continent that we can train young people in the science of vaccines and also drugs and diagnostic development. That is all going to be part of this business plan or strategic plan for vaccine continental development. We are hoping to develop partnerships with universities, regionally, so that young people can be trained en masse so that they can actually be versed with the science of vaccine development and also diagnostics and treatment. I always like to take the 3 together because, I mean, to win any war against any pandemic, you need the diagnostics, you need the vaccines, and then the treatment. So that is one arm of our new public health order. The second is strengthening our own public health institutions. Those things that I just mentioned do not happen in a vacuum. You have to have strong national public health institutions, the likes of the CDCs. I mean, in other words, a simple way of putting this is to have every country to own their own mini CDC so that we work in a network. Then thirdly is really focusing on working with the private sector. We have to work with the private sector actively because it is very important that we do that and look at disease threats, not just as a social occurrence, but also from the economic and security dimension. And lastly, local manufacturing. of both diagnostics, pharmaceuticals, as well as diagnostics. So those are the 4 pillars of this new public health. So you can see clearly that workforce development, or what we are calling human capital investment, is critical. And you continue to hear this resonate across the continent, because that will be a great challenge for us to meet all our pressing demands for public health security, or health security in general for the continent.
Thank you very much, John. Bonisile Makubu has come back with a second question, and she says, we have heard that India is rolling out COVID-19 treatment drugs to recovering patients, and she names these drugs as allopathic and Ayurvedic medicines, which I am assuming are Indian traditional herbs, as she writes. So she goes on to say distribution of these medicines has been started in community COVID care centers, in dedicated COVID-19 health centers, and COVID hospitals in various states in India. However, it has not been approved by the WHO. So she's asking, what is your take on that?
My take is simple, that we should make sure that any drug that we recommend for the use by patient has the right safety and efficacy data, and that is reviewed by an authorizing, recognized national regulatory authority. That is just the simple answer to that. We do not encourage that people just take drugs because someone has said they are safe and efficacious. It should really be backed by science and data, and also standardization. I think that is our position and has been our position for long.
All right, thank you. I see that we have Sophie Mukwena, and she has put up her hand. Sophie, do you have a second question for us?
Yes, actually 2 questions. One on when you administer these vaccines, you have those that are supposed to have that are being administered in 2 doses. What are the advantages and disadvantages of having a single dose? Can a single dose be effective if you are struggling to get a second dose, for example, your Pfizer? And then the second question, the G7 meeting next week, as Africa CDC, what will you like to see the leaders at the G7 summit, perhaps in terms of their agenda? What would you like to see as one important issue on the agenda of the G7, particularly because our South African president will be there as a guest, and I am sure some other African leaders will be there at the G7. What do you hope to achieve with this delegation going there from the continent, looking at the current challenges of COVID-19?
So, Sophie, let me start with the second question. And you asked what is the one key thing that I want to see. But since you asked 2 questions, I'll respond with my two requests to the G7. First of all, I think the G7, I would like to make a moral case to the G7 that our limited supply of vaccines on the continent is definitely a serious health burden for us, a serious economic burden for us. But perhaps it is a greater moral burden for those who are sitting on excess doses of vaccines because they absolutely want to be on the right side of history. And so my number 1 ask for them would be distribute those doses that you are sitting on now so that history can record it properly, that you did the right thing at the right time. My second request and last would be that let's get out of this crisis looking better than we went into it, that work with Africa to expand vaccine diagnostics and therapeutic manufacturing capacity. If you do that, it is for the collective interest of the world's health security and not just for Africa, because as we know, we've always said since the beginning of this crisis that no one is safe until everybody is safe. We see how these variants are emerging, and we just don't know what the impact will be on vaccines, especially long term. So by distributing the vaccination architecture and design on the different continents, we minimize the risk of what we are going through today, which is creating greater inequities there. We should never allow scarcity be the enemy of inequities with respect to these health security commodities. I think those will be my two requests for the head of states or the leaders of the G7 and our own leaders who will be traveling. I have no doubt, and I have not cross-check this with President Ramaphosa because he's the COVID champion for the African Union. But I have no doubt that he's going to echo justice because he's extremely passionate with this topic. There are two things there for him to show. The fact that he set up the Avat, the African Vaccine Acquisition Task Team when he was chair. The fact that South Africa and India have pushed aggressively for the waiver for the intellectual property speaks to the fact that he championed this cause from his heart, and I have no doubt that he will be expressing that freely and openly like he's done in the past during the G7 meeting. On the doses, there's clear evidence that administering even one dose begins to offer you protection. There is no doubt about that. I think we've seen this over and over, including in Israel, where they were one of the first countries to vaccinate quickly, where immediately after the first dose, you saw that the rates were decreasing. They still require, for those vaccines that require 2 doses, that after a period of delay, you take your second dose so that your immune system can be completely enhanced. But there's scientific evidence that even with 1 dose, you begin to have some protection from disease, developing disease, not necessarily from preventing you from getting an infection, but saying that even if you're infected, you will not develop a severe illness and mortality, that is death, will be limited. So I think I encourage everybody to, if you have access to even your first dose of vaccine, just take it. And I mean, the best vaccine is the one that you can put on your arm.
Indeed. Thank you very much, John, for that. Let's move on to Claire Keaton, who is with the Sunday Times in South Africa. And she says, in South Africa, health workers are expressing more confidence about dealing with the third wave infections now that many of them are vaccinated. Does the Africa CDC have any information about how health workers across the continent are responding to vaccination rollouts in their countries?
Health workers overall have received vaccination appropriately. And again, unfortunately, our continent is not a country. I mean, I like to call it a country continent. And so what that means is that you see very diverse patterns. Some countries where health workers have actually been extremely supportive and engaging in the process. And of course, you have a few countries where health workers are taking a more skeptical approach. But what we are seeing from scientific studies is that vaccine hesitancy, regardless of which level of the community you are engaged, is not static. That people want to observe others vaccinate, and if they don't fall sick, it doesn't cause harm, they would naturally gravitate towards that. So I think when we vaccinate at speed and at scale, and people see, those who are skeptical see that vaccination is actually creating more good, there will be, I would like to predict that there will be a shift in that direction where many more people would like to get their vaccination, including healthcare workers.
Thank you very much. I don't see many other questions coming through, but I'm sure colleagues are still writing them down. So while we wait, Dr. John, there is this message that has come through today, and it says it's coming from the Ethiopian Ministry of Health that they will soon be adopting the African Union's trusted travel guidelines, and specifically that travelers exiting or entering through Ethiopia to all destinations shall, from the 7th of June 2021, be expected to present a digital negative COVID-19 certification at all ports of entry, and this is based on our trusted travel guidelines. Can you just confirm that and perhaps then explain how this digital document is going to work?
No, that is very good news from Ethiopia. Again, it shows the continuous leadership that Ethiopia has always exercised in this fight. If you recall, last year we launched the Trusted Travel platform, which is really an Africa CDC, African Union process, which is supported by the Panobao and Econet. I mean, very strong colleagues behind that, Dr. Edem in Ghana, Mr. Strive Masiwa's group, are the kind of back engine supporting us there. What does it say? It says, we want to be sure that when you show up with a negative COVID test, it is actually coming from a trusted source. It's coming from a laboratory that has been vetted and is verified. I think that is, that verification means those laboratories, we've captured them into the platform, and you can actually get that code and you can easily scan it and know that where the test came from, and you can match that, the results you see right there at the airport with the lab that it came from. So it will minimize the negative impact of people trying to tamper with the test results. I think that is extremely a positive development. Ethiopia is not the only one that has done that. I think Kenya and other sites of Rwanda have all engaged in that process. And as we speak, we continue to engage with major airlines and hubs across Africa. So it's a very good thing. That the beauty of this is that this is all homegrown technology developed by the Panobao group in Ghana, which is driven by the Afro champions, which we work together all the time. And then, of course, with Econet, it shows that we can actually produce technology in Africa that will help solve our own problem. That is solving our problems using our own methodology and approaches. I'm very encouraged to see that Ethiopia is joining. Ethiopia is a hub, major hub on the continent. So by Ethiopia Airlines joining this, I think it's a good sign that the whole program will take off significantly in the coming weeks.
Thank you very much. It is very encouraging to see that the public-private partnership is working for the people of Africa. So thank you very much. Perhaps now we can go into your concluding remarks, highlighting the main issues that you want people to take away from this briefing today.
Thank you, Win. And my main message today is really continue to engage with community to make sure that we assure the communities that vaccines are safe and that we collectively fight against any vaccine hesitancy. The only way out of this crisis is to vaccinate our people at speed and at scale, and make sure that we also apply the principles of fairness, not just across the developed world and developing world, but also within countries in Africa to make sure that the fairness applies across the board. I think the whole principle of fairness, which we had a meeting in December only to discuss the approach of what do we mean by fair allocation of vaccines. So I think that is key. I mean, and it requires that we all work together in this space. Africa CDC would not succeed alone. We need the voices of politicians. We need the voices of the big voices of the media, all of you here, to join forces in that. My prediction is that in the coming months, when our vaccines through Avat begin to roll out from the beginning of August, we'll need to work with you more for vaccine uptake. But the time to do that is now, to prepare the population is now, where we engage with that population, clarify as much as possible, and demonstrate that those who have been vaccinated so far have not fallen ill. I think that is it's a continuous battle we have to engage. We cannot let misinformation and disinformation derail our vaccination program on the continent. Thank you.
Thank you very much, John. That was Dr. John Nkengasong, the Director of the African Union African Union's Africa CDC, just taking us through the situation of COVID-19 on the continent and also answering to quite a lot of the questions that have come from colleagues from the media. So Dr. John, I want to thank you very much as usual for joining us every Thursday. And colleagues, we do this every Thursday at 11 a.m. East African time. Let me also take time to thank you for joining us and for your continued interest in talking about this issue of COVID-19 and how we can get our continent back on track socially and economically. Thank you to colleagues from the African Union and the Africa CDC behind the scenes. We meet again next week, Thursday, 11 a.m. East African time. My apologies, that's now 12. It used to be 11, yes, but now it is 12 noon. Yes. So join us 12 noon, Thursday next week from the African Union. Thank you and bye-bye.